problems within South Africa's public health facilities have been well documented over the years. There have been complaints about long waiting times, not enough facilities, and of course a shortage of nurses and doctors. Poor communication between doctors and patients has also been a big problem, a barrier to successful care. Newzroom Afrika's Katleho brings us the story of a Johannesburg woman who's been at the receiving end of these huge problems.
Shelley Ashley Pretorius has been in pain for exactly 1 year.
I just got really sick suddenly. I started having really bad abdominal pains, and I'd been vomiting, and I couldn't keep down food, and then I'd also lost like a lot of weight in a very short space of time. And then it became more concerning with me passing out and losing consciousness.
So began her journey to end the pain and get a diagnosis. But 3 different hospitals, and 1 year later, she is no closer to knowing.
I started at Rahima Musa, and then they transferred me to Helen Joseph. And then I was in Helen Joseph. I think I was there for, about 9 days, if I'm not mistaken. I was still very sick, like in hospital, not eating, not being able to keep down food. They'd still not figured out what was wrong. And then they'd ordered more tests. Then I'd had a CT scan done as well, just to try and figure out what was wrong. And then from there, it was still kind of like inconclusive, where they couldn't figure out what the actual cause of everything was. And originally, like they had said, it could be gynae. So then I was referred back to Rahima Musa for them to investigate. And then they still had the conclusion that it wasn't anything gynae related. When they had done the lab scope, the doctors had stated that they found some abnormalities, but it was on non-gynae organs. So then it was back to Helen Joseph, and then it was a whole bunch of tests again as well. And then from there, I was then referred to Baragwanath.
Doctors agreed with Pretorius that something was very wrong, but what?
I was still like in the unknowns, basically, and then I got referred from their casualty department to gynae because they suspected it being a gynae-related problem, and then again had sonas done and tried to locate what this mass is or where this mass is.
Then she was told to prepare for surgery as the mass had to be removed. But the surgery never happens. Instead, she lies in a ward for 2 days before being discharged and told to return if the pain gets worse. It turns out that the mass wasn't the diagnosis doctors thought it was.
We go from having been told by junior doctors that there's this mass. We are then told on Monday, when we met with the consultant in gynae, that the mass that the junior doctors saw was actually an inflamed bowel, based on the fact that there was a kidney infection, and based on the fact that they're learning. You can't let someone lay in your casualty for 2 days and then just discharge them and say, okay, well, when it gets worse or when the mass gets bigger, then come back to us.
It is this lack of communication that eventually led them to lay a complaint with the health ombudsman.
I understand that it's an academic hospital, and I understand that there are juniors, but surely there's a senior that's supposed to do oversight.
Pretorius is now being treated for shingles, and although not diagnosed, she is being treated for endometriosis.
So at this point, I feel like taking all of the medication, yes, as much as they feel as if it's helping me, I feel like, could it not be doing more harm to my body at this point? There are moments where I do feel like I am probably going insane.
The CEO of the Chris Hani Baragwanath Hospital notes the number of challenges faced at the facility. One of the main ones being the ratio between the demand for healthcare and the number of medical practitioners available.
We are providing at Chris Hani Baragwanath, for instance, a healthcare service to more than 60,000 patients a month. And yes, we do receive complaints, and those complaints, they come for different reasons. Some of our patients feel that our staff attitudes are not appropriate. Some would complain that they have not received the care that they think they are supposed to receive.
Shirley Ashley hopes that by speaking about her case, those in a similar situation can urgently get the help they need. For Newzroom Afrika on Channel 405, I'm Katleho Sekhotho in Diepkloof, Soweto.